Hi there, so today we want to look at how you can shrink your enlarged prostate and also how you can fix your urine flow. Even as we are very aware that most of us are aware that the matters of the prostate gland is very common in males than females. So today's video is a bit directed to males than females, even as we are talking about prostate cancer and also benign prostatic hyperplasia. In today's video, we will get to know the difference between the prostate cancer and the BPH, and then also some solutions, even as somebody might be watching the video and has any of this condition. But before we get into the details, and even as we talk about the solutions and the things that we should stop doing, we like to differentiate between benign prostatic hyperplasia and prostate cancer. All right, and so the enlarged prostate situation is extremely common as men ages, and then we realize that 1 out of 2, that is 50%, will get an enlarged prostate, and this is called the benign prostatic hyperplasia, which basically means that there is an enlarged prostate. Like I said earlier, but before we get into the details of that, I want us to know that it isn't a complete problem if you understand it, and there is also a great solution that we are going to be arriving at. Like I said, we are going to differentiate between the BPH, that is a benign prostatic hyperplasia, and the cancer of the prostate. So now we ask ourselves, are they similar? But so over here we see the BPH, that is a benign prostatic hyperplasia, and then we see the prostate cancer also at this side of the screen. Now we realize that the BPH does not spread and it does not turn into cancer, and also it's not deadly. But when we come to the prostate cancer, it's seen as the damaged normal mitochondria turn into cancer, and it's also very deadly. So we have to know the difference. And in today's presentation, we are going to be very specific. We are not going to talk about prostate cancer. We want to talk about the benign prostatic hyperplasia. All right, so let's do this thing very quick. Some symptoms of prostate cancer, so that you don't actually get it confused that BPH is actually prostate cancer. Now, in prostate cancer, the person normally has painful urination, blood in urine, blood in semen, painful ejaculation, and the person might not get an erection also. These symptoms will actually let us know that this person is suffering from prostate cancer and not benign prostatic hyperplasia. Today's video, we are not going to talk about prostate cancer, but I'd like to give us a fair idea of how the prostate cancer works, and I'm going to be referencing from a study that was made from castrated men or castrated males, and how the outcome became. And after that, we will go into the actual topic that we are talking about today, even as we want to know how we can shrink the enlarged prostate and also fix our urine flows. Now, before we talk about the prostate cancer, even as I talk about the referencing, now BPH has got to do with the urinary tract, that kind of organ. The BPH is associated with a lot of urination problems, and how the person finds it so difficult to urinate and sometimes becomes so uncomfortable, especially at night. So the BPH, even as we are talking about it, that it has urine problems and that, so you actually you may have the urge to urinate, but you can't urinate, and you can't fully eliminate the bladder, and so it makes it a bit inconvenience, and this makes the BPH to have a lot of different urination issues. And like I said, it's simply because the prostate is a gland, And if it wraps around the urethra, which is a little tube from the urinary bladder that comes, out through your penis, and as the prostate enlarges, it obstructs the tube, and you are not able to fully eliminate freely all the urine that is supposed to come through out your urinary bladder. Now, the prostate is actually supposed to be just like the size of a walnut, even as we are looking at the image here. So like the size of the walnut. But it can actually become bigger than that, and that's when it becomes a problem. Now, but with the prostate cancer, let's find out that phytonutrients, specifically phytoestrogens, can actually make the situation worse if somebody has, what do you call it, prostate cancer, and the person takes phytonutrients. Will it make the situation where there's been a lot of a school of thoughts that go against and for? But I like to say something short about it from a data that has proven what it actually is. And so we get to realize that there are certain compounds in herbs, in vegetables that mimic estrogens, which are normally called phytoestrogens. And we also know that estrogen dominance in general can cause cancer in women, and of course that is the breast cancer, which we know, but also in men as well. And a lot of the chemicals in the environment, they mimic estrogen, like the pesticides, the insecticide, the herbicides, the fungicide, heavy metals as well. And so they are all considered as estrogen disruptors or endocrine disruptors. But when we get to plant-based estrogens, like the phytoestrogens, there's a couple of things we need to know with phytoestrogens. You can actually prevent prostate cancer. You can also slow down the progression if you have prostate cancer in the early stages. But if you are in the stage 3 or 4 or more, you may want to hesitate. There is some data that these phytoestrogens can actually make things worse. But I want to make a side on this. The studies that I read on this were related to castrated males. So if someone is castrated and may have advanced stages of cancer, they should not consume any phytoestrogens, even in small amounts, because it can make things worse. However, the purpose of this presentation is to focus on enlarged prostate, and also how we can fix urine flow, even as we look at the shrinking aspect of it also. So we want to be very specific on the enlargement of prostate, not the prostate cancer. So there are two main theories that I've come to know, even as they talk about how men get benign prostatic hyperplasia, that is the BPH. I think they are both correct, because they work together, and we are going to go down into these theories, which I also agree. And at the end of the presentation, we are going to realize that these theories are going to work hand in hand. And so let's take a look at it. And so we realize that the first theory has to do with when men ages, their testosterone, it goes down. And so both men and women have the estrogen and the testosterone. And so when the man's testosterone goes down, that's one of the theories, even as the man is aging, then estrogen is now shooting up. And as estrogen begins to shoot up, what is going to happen? And so in men, we realize that there's going to be a ratio of a higher level of estrogen and a lower level of testosterone. Interestingly, even as we have realized that in the male, the ratio of the estrogen is now higher than that of the testosterone. And so the higher levels of the estrogen is actually going to enhance or cause the pituitary gland to trigger another hormone called prolactin or prolactin. And what this hormone does is that it has the ability to also enlarge the prostate. So now one of the theories which we are talking about is in line of our studies. And so we need to understand that. We know that, even that's the prolactin, that's, it's actually going to, cause an enlargement in the prostate. And the first theory now is talking about when a man is aging. And so we also realize that as one ages, many times, they gain more weight, they have, more fats, and the more fats you have, the more estrogen you're going to actually have because there's a certain enzyme that is going to convert your testosterone to estrogen, and that enzyme is called the aromatase enzyme. And this happens in both males and female. If your liver is damaged, is inflamed, scar tissue, cirrhosis, it is actually going to produce more estrogen, and that is going to put you very close in that kind of field of you contracting this kind of situation. I'm very sorry to say this, if you take alcohol, especially beer, it has the ability of reducing the testosterone and increasing the estrogen. And so normally alcohols, they have the ability to reduce your testosterone and increase the estrogen. That can also put you very close to this kind of condition which we are talking about. So I'm very sorry, alcohol doesn't really help when it comes to this subject matter we're talking about. All right, so it's only the estrogen 2 that can enlarge the prostate, not estrogen 1 or estrogen 3. And all those phytoestrogens, that is those plant-based compounds that affect estrogen, only affect estrogen 1, not 2 and not 3. And so basically phytonutrients don't enlarge a prostate. However, they do attempt to go into receptors in estrogen 2, they end up blocking them. So other types of estrogen cannot create the effect, and so they help lower the estrogen 2, which indirectly protects you against this prostate enlargement. Now, second part of this puzzle also involves that when your testosterone goes down and your estrogen goes up, the moment you begin to have that kind of condition whereby your testosterone is going down or has gone down, when you have that kind of situation, you have the ability to produce a very powerful hormone called the DHT, which is produced by the activity of an enzyme called the 5-alpha reductase. We talked about in some of the videos we have made so far. And so what this hormone does, that I'm talking about, the DHT, what this hormone does is that it has the ability to cause hair loss, and not just the hair loss, but also it is going to help in the enlargement of the prostate, and it is something that we can't allow it to happen. There's another interesting fact over here. Those people that genetically they can produce DHT will never have a prostate enlargement. Yes, of course. So now we ask ourselves the question, which I've said earlier: what enzyme is behind this DHT, the production of this powerful hormone DHT? That is a 5-alpha reductase. And so based on these two mechanisms, we are going to look at certain things we can put in place to lower this enzyme, to inhibit this enzyme, so that DHT will not be produced, and the enlargement of the prostate will also be avoided. The first one that we want to look at, even as we're looking at the ways to avoid this kind of situation, is to consume more of phytoestrogens. That is really going to help you. So now, the phytoestrogen that I really like to recommend, even as we are talking about this prostate enlargement, there's actually a very well common one called ginestein. A lot of people take it for enlarged prostate, and ginestein is a phytoestrogen that is in a lot of legumes. It's in a lot of different things that can help with this enlarged prostate. Now the second one, let's look at some cruciferous, vegetables like broccoli, kale, cabbage, Brussels sprouts, all increase the amount of phytoestrogens in the body. So I think you should start eating those foods on a regular basis. Yeah, it's really going to help. They will not increase estrogen too. Like I said, they will block it, and that is something that we really want it for ourselves. And when it is blocked, it will help to prevent other things from entering into that receptor that can actually cause enlarged prostate. A mechanism that we can also stop this enzyme by also trying to convert testosterone into estrogen, and that is in your fat cells, like I said earlier. It's in other cells, and so by taking aromatase inhibitors, which we are going to learn about those ones, but of course there are synthetic drugs that are aromatase inhibitors, but I'm not really going to recommend those ones. But let's look at something very simple here. You can just blend the entire lemon fruit, including the peels, the seeds, white parts, and everything, every morning with some stevia, and you blend it in some water and drink that. This can act as an aromatase inhibitor, and it is natural. Stinging nettle root is also another powerful aromatase inhibitor, which I think that you can take, and it's really going to help. And not just that, it also has an anti-inflammatory property as well. Now let's look at the DIM, which is a concentrated cruciferous compound. Now what do we get from DIM? A concentrated cruciferous compound that you can take as a supplement, and it greatly helps in the balance of excessive amount of estrogen, like I said earlier. And it's also going to help to block the other enzyme, that is the 5-alpha reductase. For instance, in the other videos that I've made, I have mentioned this product, and it has appeared here again. Saw palmetto is very good for prostate, and we should also check into that. We should also get to know that pumpkin seeds, green tea, zinc, these compounds inhibit this enzyme, and it's really going to help. So we should also take advantage of these compounds: pumpkin seeds, zinc, and green tea. Very, very, very effective as an inhibitor of this enzyme. On the flip side, you would also want to avoid certain things that's for instance, high levels of insulin in the body. It serves as a growth for the prostate enlargement, and you would have to go into a very healthy keto diet or intermittent fasting. You can check down there. I have videos on that, and that's really going to help you. Also, you have to avoid dairy products, because dairy products, they have estrogenic compounds, and these estrogenic compounds are really not going to help, because we are trying to lower the level of estrogen so that it wouldn't be a growth for prostate enlargement. So we have to look at dairy products. Yeah, I'm very sorry to say this, but as a male, and having these same things that we are talking about of the prostate enlargement, and you are fond of taking alcohol, I think you have to advise yourself, because alcohol, like I said earlier, is really not going to help. But you can also try kombucha tea. Kombucha tea is similar in texture like beer. Yeah, and it's healthy. So you could try the kombucha tea, which is just like beer, even in texture, and that is really going to help. So I'm very sorry, alcohol doesn't really help when we are finding ways and means to shrink the prostate. Now the last one, which I'll be bringing everything to an end, is the consumption of plastics. Somebody will be like, but I don't, how possible? Yes, of course. Plastics are in there. They are minerals that they are in the soil. They are in the water that we drink. For instance, tap water. Tap water without a proper filtering system can actually make one to consume plastics that can mimic like estrogens, and this will also serve as a platform or as a growth for prostate enlargement. And so you would have to be very careful that even as you drink tap water, there is a proper filtering system that it's really going to help to avoid this mimicking of estrogen that is going to, you know, enlarge your prostate. Thank you so very much for making time to watch me on this channel. I really appreciate you to have you to watch me. If you like this content, kindly subscribe to my channel, and you can also share this video and put your comment below. Thank you. Hope to see you another time.